Hi there, I'm Kelly Dean, physical therapist and founder of the Tummy Team. We specialize in functional core strength, and because of that, we have the opportunity to work with a lot of pregnant women. We work with them during their pregnancy, preparing them for labor, delivery, and during their birth recovery. And this video is going to share how functional core strength can impact optimal fetal alignment and how that's important information to know. First, we're going to say that labor is pretty unpredictable. A lot of things are out of our control. We can't control, for instance, the size of the mom's pelvis, the length of the mom's torso. We can't control how big the baby is, the size of the baby's head, or even sometimes the position or shape of the mom's uterus. There's a lot of things we can't control. However, there are some incredible things that we can control and some things that we can do with functional core strength that can dramatically impact how the body aligns with the baby and how the baby is born. So first, we're going to talk to you about defining some of the terms we're going to use. Optimal functional alignment. That's a term that we use to talk about the ideal position for the baby in the womb to help mom throughout her pregnancy, and mom and baby in labor, delivery, and mom in birth recovery. This is a little bit different than the term optimal fetal positioning, which was coined by Jean Sutton and Pauline Scott in the 1990s. These are some amazing New Zealand midwives that talked about how the mom's position in pregnancy, at the end of pregnancy, can shift how the baby positions in preparation for birth. So they're talking right up around birth with optimal fetal positioning. And there's also a term called best position for birth. And that refers to that head down position with the baby's back of the head and back of the body kind of facing the front of the mom's pelvis. That anterior position is what that's called. And that's the optimal birthing position for the baby. These are all different terms, but they complement each other. The difference is that our term optimal fetal alignment is really talking about the whole pregnancy, birth, labor, and birth recovery, not just the few weeks right around delivery time and the actual time of delivery, although it includes that. We look before and after. So what is functional core strength? Functional core strength refers to your corset muscle, this big abdominal muscle called your transverse abdominus, as well as the other abdominal muscles, back muscles, pelvic floor muscles, and diaphragm muscles. All of these muscles in your core that actually connect from the pelvis to the rib cage and elongate you, align you so that you're not kind of off kilter, and stabilize you. They stabilize your spine, they stabilize your pelvis, they stabilize your rib cage, and it gives you the strength to hold yourself up for functional activities like sitting and standing and walking and lifting and all the things you do throughout the day. And in terms of pregnancy, the functional use of this core is to support the uterus as it grows during the pregnancy, to support mom and baby for labor and delivery, and to support mom for birth recovery. So those are all functions of this core, and that's how we're going to look at how the two go together. As a PT, we have the luxury and the benefit of working with clients throughout their pregnancy. We're not just limited to what's happening at the birth like a lot of birth professionals are. We can do things far before birth to prepare the muscles and to prepare the body's alignment for the optimal baby alignment as well. Okay, so we also have the benefit of seeing them after delivery for multiple sessions. So we're not just in one little area, and this is why we're going to talk about what we do and how this functional core strength, which is completely achievable, can make a big impact on your entire pregnancy and birth. Okay, so we're going to talk about pregnancy first, and then we're going to talk about labor and delivery, and then we'll talk about birth recovery and postpartum. So in pregnancy, you need to understand that transverse abdominus, this is a muscle that starts back here on the two sides of your spine, wraps around, attaches to the lower 6 ribs, all the way to the pubic bone on the pelvis, and to this line of linea albia, this connective tissue right down the center. it connects and wraps around, and as a result, it holds the uterus up and in. It also positions the pelvis in a neutral position and the rib cage in a neutral position. So neutral pelvis is here, not excessively tucked, not excessively lifted, but right in the middle where the pelvic bowl and the rib cage bowl line right up and top, and the core holds everything up and in. So what this looks like, what functional core strength looks like in a pregnant mama, is often kind of a pulled up and in belly. So a little bit more compact belly is often what you see. Not always, but often. You also see a better overall posture alignment. You also see them taller and their core lengthened. How this feels to mom is less back pain, less hip pain, less pelvic pain, pubic bone pain, sciatica. This feels like a stronger, more stable kind of body and corset area. And there's a lot less pressure on the abdominal wall, specifically on that linea albia. And when there's a lot of pressure on that linea albia, sometimes it separates, causing a weakened area or a diastasis in the middle of your abdominal wall. But when we have a nice strong core, the pressure on that linea albia is much less, and it puts the baby in a better position and mom in a better position. This also encourages baby to have the full access of the core, because the pelvis is put in a position that lengthens and opens up that lower part, where at the end of the pregnancy, baby needs to kind of be able to shift down into. All right, so we look at this throughout the pregnancy to help mom feel strong and mobile and active throughout her pregnancy, but also to put baby in optimal alignment to kind of move around and get situated closer to like the exit, basically. So how this affects labor and delivery, how functional core strength affects labor and delivery, well, first you have to realize that there's several factors involved in how labor gets started and what keeps it from stalling. All right. One of those factors, and it's a significant factor, is the pressure of the baby's most presenting part, hopefully it's the baby's head, on the cervix. The pressure of the baby's head on the cervix, and the cervix is that opening between the uterus and the birth canal. And it starts out kind of thick and closed, so the baby doesn't fall out when we don't want it to. Okay, but as the baby's head gets bigger and gets in an optimal alignment, the pressure down on that cervix, when that pressure is symmetrical, which means that it's hitting all areas of the cervix evenly and directly down, that causes this softening and thinning of the cervix that also opens the hole that lets baby get through. So when the body is in an optimal alignment and baby is pressing straight down, then that cervix can kind of gradually kind of keep softening and moving, and each softening causes another contraction to push down. Now, sometimes stalls happen because baby's not in the best position, and maybe only part of the baby's head or presenting part is hitting that cervix, and only an area is softening and the other side's not. So there's not as much of a feedback loop to keep the contractions going. The body kind of tries to get things going, and if it doesn't work, it kind of takes a break, hoping things are going to shift, and then it'll try again, and if things aren't working, it'll take a break. And that stopping and starting is exhausting. And we want, a nice rhythm to go throughout labor so that there's less interventions, so that baby just is moving through and not getting distressed, and mom's not getting exhausted. So what's cool about that transverse abdominis is it wraps around symmetrically. It's not like your right muscle and your left muscle, or your front and your back muscle. It's one muscle that wraps around. It's the only muscle actually that wraps right around your body, and in one muscle gives you symmetry, pulls the uterus up, putting baby in this optimal position, which also reinforces what gravity is already doing, pressing down on the baby's head and to the cervix. So this core strength can help get the uterus in the optimal position, to put baby in the optimal position, to put the cervix in the optimal position. Okay, see where this is going? Now also, because functional core strength also is married to a neutral pelvis. That neutral pelvis keeps everything open and elongated, allowing the baby to move down into this area freely. Now, the alternative of this kind of crunched position kind of puts the body in a position where if you think about your pelvis, the pelvis here and here's your spine and you're putting here, there's not as much room for that baby to move as here. When the spine is here and the pelvis is here, now the baby has all this room to move down in to the front of that pelvis, which is what we want. So we want as little delays as possible. We want that symmetrical pressure on the cervix so things are going along, and this is where core strength can really help you. It is ultimately the uterus that does all of the pushing. The uterus is one of the strongest muscles in your body, but the transverse wraps around and supports the uterus and puts it in the best position to get the most bang for its buck. So during pushing phase, having that core be very connected and strong allows you to pull baby up and in. At the same time, we train our clients to activate the core, the transverse, and relax the pelvic floor at the same time. And we do this way before the pushing stage of labor so that you're not in the most intense thing in your life learning new information. We already create this muscle memory months ahead of time, weeks ahead of time before delivery so that your body knows how to draw the tummy in and relax the pelvic floor. You don't have to hold your breath to do this. It actually works best if you are breathing through the whole process, and it puts baby in the best position and opens up the pelvic floor so that baby can come out easily. This is not this hunched, holding your breath, bearing down, which bulges the tummy, bulges the pelvic floor, and uses air pressure and almost pushes the baby kind of in this position to go around a corner to come out, versus the transverse coming in and pulling baby up in this position to allow him to go straight out, okay? So pushing, being able to breathe helps you, because you get to have oxygen that whole time, helps baby because baby gets to have oxygen the whole time, and helps that passage to be a much smoother process because you're releasing the pelvic floor as the core is putting everything in the best alignment. So this really helps to have less tearing, less trauma on the abdominal wall, which is going to translate right into what's really important in birth recovery. So birth recovery, postpartum, after the baby's out, you now have a newborn to take care of, which is actually pretty physically demanding. There's a lot of holding and nursing and bending over and lifting and carrying car seats. There's a lot of physically demanding things that your body needs to do on very little sleep, with your hormones being very crazy, with a very loose tummy. So the less trauma, the less excessive pushing out on the tummy and pushing down on the pelvic floor, the faster the recovery of those muscles that are needed for newborn care. The other thing is you create a muscle memory during pregnancy and use that muscle memory in labor and delivery. So birth recovery, you're not drawing from this really distant memory of how did my core work before I was pregnant. It's a real recent memory. And you can actually draw from that brain-body connection to help you really connect and rebuild this kind of stretched out muscle. So that muscle memory is going to be really important for birth recovery as well, because we really want you to be a strong mother. There's a lot of unpredictability throughout the whole labor process, but we know you're going to have a baby to take care of, and we're going to rely on that. And we're going to rely on the demands of what that looks like and help prepare your body for that, regardless of what happens during your labor. Everything that we do actually helps your labor be better, but because of the unpredictability, we're also really focused on that birth recovery time. Now, some things to consider for baby and birth recovery and fetal alignment is sometimes babies have conditions like torticollis, where their head is turned and really tight on one side and kind of stretched out on the other side. Sometimes they come out with a shoulder dysplasia where the shoulder's kind of tweaked. Sometimes there's excessive molding in the sutures of the skull, and their head kind of comes out like this with those sutures kind of overlapping. There's all these things that sometimes are traumatic for the baby that are really related to less than optimal fetal positions in utero and during the birth. Now, even in the best birth situation, sometimes those things happen. So this is not to point blame or anything or make you to feel bad. We just want to give you options. We want to help you help your body and help the baby have the best experience possible, and minimize and eliminate as many complications as we can. So what about some special conditions? So we've so far talked about baby being upright, head down, but there are other less than optimal fetal presentations, right? There's breech, where the baby's butt first, footling breech, where the feet are first. There's transverse, where the baby's kind of laying this way. There's less kind of severe malpresentations, like acyclitic head, where the head is just turned slightly and it's kind of hitting here instead of here. There's brow coming first, and then there's even posterior, where the baby's head is facing towards the back, or facing front, but that back of the head is going to go down along the tailbone, and that causes a lot of back labor, and it can stall out labor as well. So all of those presentations, sometimes you get close to the end of your pregnancy and the baby's not in the optimal position, and you can tell. The midwife can tell, the OB can tell, the ultrasound shows you baby's not in the best position. So there are a lot of programs out there that specialize in that end of the pregnancy, trying to get baby in the best position. And a lot of our clients will say, aren't these positions that they're asking us to be in, like hands and knees position, excessive anterior tilt positions, leaning forward position, even sometimes laying on your back with your feet up, this reclined position, or tilting your pelvis the opposite way? Aren't those contradictory to what the tummy team teaches, which is neutral pelvic bowl, neutral ribcage bowl, elongated upright positions? They're not really contradictory. I know it sounds that way, but what you're doing in these programs are temporary movements to give the baby opportunity to move into a different position. You are not going to live in this position. You're going to spend some time in this position, relaxing the muscles, allowing baby to shift into a better position, and then you're going to come back to your neutral position. If you lived in this excessive position thinking, oh, I'm going to open up all this room for the baby, your back's going to kill you, and your abdominal muscles are going to be off throughout your whole pregnancy, making it very difficult to push the baby out and making it very difficult for birth recovery. So we're looking at the strength throughout your whole entire pregnancy and preparing the muscles for the demands of labor and delivery and birth recovery. But sometimes putting yourself in different positions allows baby to shift and get into a better position for birth. Now, one of the reasons that often these excessive positions of anterior tilt and bending forward are necessary is because people haven't done functional core strengthening in their pregnancy and haven't been in neutral pelvis and have spent a lot of their pregnancy sitting in bucket seats on slouched couches, sitting on their tailbone, kind of collapsed in this position, taking that pelvic bowl and ribcage bowl and putting it here and giving very little room for baby to get into that lower area of the uterus where it needs to, and giving the back very little room to turn and kind of get into that front area. The work that we do, putting you in neutral alignment and elongating your body throughout your pregnancy, supports getting baby into those positions. Your muscles are strong, but they're not strong enough to keep baby from moving. What's the problem is when the bones keep baby from moving, and when there's no anatomical movement available or room available because the pelvis tilts and it's so close, the angle is so close to the spine that the baby can't actually get into that space. So that's sometimes why those excessive movements are required. It's because mom was not in best alignment throughout her pregnancy. And this is a result of our cars, the places we sit at work, computer work, all sorts of things. Also, all sorts of things that we address in our prenatal core training. Now, sometimes no matter what you do, baby doesn't turn. You could do all the right things. You could be in optimal alignment throughout your whole pregnancy and baby still presents breech at the end. We don't know why this happens. There's a lot of things that we can't understand. Maybe baby was really active early in the pregnancy and got all wrapped up in its cord and now has no leash long enough to get where it needs to get to start labor or to move head down. Maybe your uterus is is kind of designed just a little bit sideways. We're all designed a little bit differently inside. Maybe you have a little roomy area over here where baby wants to kind of hang out, and so naturally kind of wants to come out shoulder first. There's a lot of things that we can't really control, but there are a lot of things we can control. And functional core strength is always worth it. Even if alignment and other conditions lead to interventions that may lead to a C-section, you want to go into a C-section with a core that is strong and a body that is connected. The goal is to have the baby, and in the end, you're going to have the baby, and it may look one way or it may look another way. You're going to do the best you can, and we want to give you options to do the best you can. And functional core strength is absolutely necessary for birth recovery and for newborn care. So everything you do is going to help that. We want people to have options and to understand how their body was designed and understand how the functional core strength can impact optimal fetal alignment and how that impacts your whole birth experience and your birth recovery. We see clients in our office all the time in Washington. We'd love to work with you. We also have several prenatal online programs that will help you step by step go through the process if you can't come and see us. There's videos that take you step by step through very realistic and doable things that are going to help prepare your body for pregnancy, labor, delivery, and birth recovery. So check out more about what we do at thetummyteam.com. Thanks so much.